After the break, the death of actor James Van Der Beek raising new questions about reducing your risk of getting colon cancer. We'll be talking live with a doctor from MedStar Georgetown University Hospital. Yesterday, if you were with us, we brought you the sad news that actor James Van Der Beek, the Dawson's Creek star, passed away at age 48 after his fight with colorectal cancer. And it is the second leading cause of cancer death in America. And the recommended age to start routine screening was lowered from 50 to 45 due to rising rates in younger adults. So joining us now is Dr. Benjamin Weinberg. He is a gastrointestinal medical oncologist at MedStar Georgetown University Hospital. Doctor, thank you so much for taking the time to be with us today.
Thanks for having me.
And first, as I mentioned, when we checked in here during the break, I said a lot of people, they were just stunned by this, very upset by this news. Your reaction, especially with just how young James Van Der Beek was.
Unfortunately, this is something we're seeing become more and more common as time goes on in the younger, the under 50 crowd, where historically this was a cancer of older adults, median age still in the early 70s. But since the mid-early 1990s, we've seen a rise in mostly rectal and colon cancers near the rectum in younger adults for reasons that honestly we fully don't understand. We think maybe there was some exposure in folks born in the 70s and 80s, that now we're seeing what's called a birth cohort effect of these people as they age, now getting colon cancer and rectal cancer at younger and younger ages.
How young? We say young, 48 in this day and age with all of our medical advancements. That is, people are just, getting life started almost in their 40s and figuring out what they want to do. How young are we seeing these diagnoses?
So we've definitely seen a rise in folks under the age of 50, under the age of 40. Unfortunately, the group with the quickest rise, which thankfully is still somewhat uncommon, is the very young group, the 20 to 30-year-olds. But mostly this is a phenomenon in folks in their 30s and 40s. As you mentioned, the colonoscopic screening age has been lowered from 50 to 45 for those at normal risk. But for those with a history of polyps or strong family history, first-degree relatives like siblings or parents with colorectal cancer, you should really start screening 10 years before they were diagnosed, or age 40, whichever is earlier. So it's incumbent upon all of us to make sure that everyone is getting appropriate screening for colorectal cancer.
Okay, so you recommend, if you know a close first-degree relative has had a history with this, if you've heard your parents talk about this, ask your doctor and talk to your doctor about getting an early screening if possible. Obviously this is concerning, and you do mention it is still a phenomenon. If someone in their 20s or 30s, it is more rare for those people to, not everyone in that age group is getting diagnosed with this, but what warning signs, doctor, should we all be watching for?
Right. It's important to realize that no one, unfortunately, nowadays is too young to have colorectal cancer, and things that were dismissed as run-of-the-mill constipation or rectal bleeding from hemorrhoids really need to be further investigated. So change in bowel habits, new rectal bleeding, abdominal pain, weight loss, these are things that really need to be investigated, and if appropriate, prompt referral to a gastroenterologist for not a screening colonoscopy, but a diagnostic colonoscopy to figure out what's going on. In short, for screening for folks who have no symptoms, the best screening test is the one that gets done. For those who are too squeamish to get a colonoscopy, there are alternatives like virtual colonoscopies, blood-based testing, and stool-based testing. So if a colonoscopy is not happening for whatever reason, it's really important to get some form of screening for colorectal cancer.
Yeah, and you mentioned those alternatives. We know there's a relatively new FDA-approved blood test. Who might be a good option for that specific test?
So those blood tests are useful. They're maybe not as good at picking up the pre-malignant polyps, what we call adenomas. They're more sensitive for finding early stage colorectal cancer. The best thing about a colonoscopy is it gives us our best look at the inner lining of the colon, and also we can intervene. We can remove pre-malignant polyps before they become cancer. We can even sometimes remove very early stage cancers. So colonoscopy is still the gold standard, but at the end of the day, the best screening test is the one that gets done, whether it's a colonoscopy or an alternative.
I love that, the one that you do. Doctor, your message to everyone watching as to how seriously we should take this, and also any steps we can do to make sure we are our healthiest, and any steps we can take to prevent this cancer.
So while we don't know what's exactly causing this rise in young or early onset colorectal cancer, we know things like diabetes, obesity, ultra processed foods, potentially early antibiotic exposure. There's a variety of things that there's at least circumstantial evidence that is leading to this rise. So the healthier you can be, exercise, probably the most important, eating a well-balanced diet. These are things that everyone should be doing for their health anyways, and may also help decrease the risk of developing colorectal cancer at an early age.
All right, Dr. Benjamin Weinberg, thank you so much for joining us and sharing your insight. We really appreciate your time.